So you become a GP consultant in 2 years, and in specialist you have to wait for 7-8 years. But what the money aspect? Because I have heard if you're a cardiologist you earn a lot, and if you're a GP you earn that. What do you think are the drawbacks or pitfalls of being a GP? So in today's episode we have Dr. Mughal with us just to answer your questions of GP pathway. So big welcome in the comments.
Thanks, Arjun. Thank you.
Yeah. So Dr. Mughal is a guy who is really passionate about medicine, but he's pursuing his career in GP pathway. He's gonna be a GP in coming future. So let's just ask you questions from him because he's a better person to give you some better insights. So first, Mughal, why you chose to be a GP in and not a specialist in cardio or gastro or something? What are you?
Yeah, so in GP, there's more flexibility. That's one. The other thing is you get to be your own boss a lot quicker. Your specialization takes many, many years, sometimes 7-8 years. GP, only 2 years in the community practice and you're a GP. And then there's also availability to do to have career progression. We have that as well. So that's why.
So you become a GP consultant in 2 years, and in specialist you have to wait for 7-8 years.
Yeah, roughly. Yeah. I mean, it's all rough figures, but yeah, it's a lot shorter. Yeah.
So and I have also heard about the thing like GP with specialist interest, because a lot of specialists from India and Pakistan are commenting like, I'm a pediatrician or I'm a dermatologist in India and I want to work here as a dermat. I don't think they can directly work as a dermat, but the GP with specialist interest give you points on that.
Yeah, so I mean, I've seen a lot of doctors who've got a specialization in their area of interest. If they don't want to pursue that here, what you can do is you can do your GP training and then do a special interest in your area of specialization. And of course, that will put you in the forefront of the care providers, because you will have a lot more knowledge and people would want to see you for that specialization. Yeah, there's a lot of options to do dermatology, cardiology, respiratory, a whole lot.
A specialist interest.
Yeah, like ONG, all the and PEDS as well. Yeah.
How long we have to have that diploma kind of thing or whatever this is?
Yeah, so there's lots of different things you can do. There's you can do courses, you can do diploma, you can do a postgrad. So there's lots of options. They vary from 6 months all the way to 2 or 3, 4 years. Yeah.
Okay. So next question is money basis. So what about the money aspect? Because I have heard if you're a cardiologist you earn a lot, and if you're a GP you can't earn. But just first amid, is it true?
Well, it really depends. I mean, I think GPs can earn as little as $200,000 a year, but they can earn as much as, I don't know, probably more than $1 million, depending on if you have your own practices or not. So I think it's all a myth, really. If you want to, if it's about the money specifically, you can earn as much or as little. It really depends, because there's just so much flexibility in what you can do, what you can't do. Yeah.
And what about the OPD charges?
Yeah, so OPD, in terms of OPD charges, again, they're very variable. So depending on your practice, so you can bill patients out of pocket, let's say $100 or $80 or whatever your practice charges. Usually it varies somewhere between $50 to $80. And on top of the government rebate. So the government rebate for a 15-minute consult, roughly, let's say around about $30, $40. So $30, $40 plus the $80 you get for a 15-minute consult, around about $100.
Okay, $100 from one patient to see 50.
Roughly.
Yeah,
and then you take about 5 minutes to write their notes.
That's good. And what about if you're doing some minor procedures, like you're removing some skin cancers?
Yeah, so procedures are extra. So with procedures, you can make a little bit more. So the government rebate for procedures is a little bit more, depending on what procedure you do.
So basically, even if it's an OPD or a procedure or anything you're doing as a GP, government is paying you and even the patient is paying you. So you're getting money from both of them.
That's right.
And that's a really good thing.
Yeah.
And what do you think, what's the scope of a GP in other countries? Like if somebody came here, worked as a GP, and if they want to change the country, maybe going back to India or Pakistan or Dubai, or what are you?
Well, I don't know much about about going back because I did my med schooling here. But I from what I know, in the European countries, Western countries, there's a lot of scope because there's a lot of need for family practitioners in the US, the Canada, UK, Ireland, Scotland, even down here in New Zealand. And also I've heard there's really good prospects in the Middle East and Dubai. But probably India, Sri Lanka, Bangladesh and Pakistan is going to be a bit difficult because that demand is, I don't think it's
not there yet. Yeah.
Because people directly go see their specialist and they don't have a referral point. Yeah.
And let's come to the last point. What do you think are the drawbacks or pitfalls of being a GP?
Well, I think the biggest drawbacks are sometimes, so I guess you don't take it seriously sometimes because they don't consider, some of them don't consider it as a specialty, even though it very much is a specialty. I don't think that's a big drawback, to be honest. The other drawback that people consider is that, like you said, the monetary. You can probably not as much money as you would otherwise make in a procedural specialty, which is true, but money isn't everything. The other thing we talked about is the career, like applicability in different countries. It's not there yet. Like in other specialties, you might be able to go to any country and do that specialty, but with GP, a lot of the other countries, they don't have that.
Cool.
Yeah.
Okay. So guys, if you have, I tried to cover all your questions, but if still you guys have any questions, comment below and we can try to make a new video once again for you guys. And just tell us in the comments and say bye to Dr. Mukul.
Bye.